All right, let's talk about something that so many of us have felt, that nagging, frustrating pain right in the middle of your face, that pressure behind your eyes that we all just call a sinus headache. But what if, for most of us, that's not what it is at all? So let's start with that feeling. A feeling that I'm betting is, well, all too familiar for a lot of you. Yeah, if you're nodding along right now, you are definitely not alone. This is one of the top complaints doctors hear, and for way too many people, it's this chronic, disruptive thing they just have to live with. And it makes perfect sense, right? The pain is right there, exactly where your sinuses are. You feel that pressure, maybe your nose gets all stuffy, so you connect the dots. You think, my sinuses are acting up again. But here's the twist. What if I told you that for the vast majority of people experiencing this, the sinuses aren't the problem at all? Okay, let's really dive into this, because this is where it gets interesting. The science here is honestly a huge eye-opener. Researchers have been digging into this exact question for years, and what they've found pretty much challenges everything we thought we knew. Check this out. In one landmark study, a staggering 88%, 88 of people who walked in convinced they had a sinus headache actually met the clinical criteria for a migraine. Just let that number sink in. That's nearly 9 out of 10 people who had the diagnosis completely wrong. So this isn't just some small-time mix-up. As this quote from the journal Brain Sciences puts it, sinus headache is the most common misdiagnosis in migraine. We're talking about the single biggest mistake made when diagnosing one of the most common neurological disorders on the entire planet. And that confusion sends people down a rabbit hole of treatments that just don't work. Okay, I can hear you thinking, but wait a minute, it feels just like a sinus problem. My nose gets stuffy, it runs, and you're absolutely right to think that. That is the very heart of the confusion, and there's a really clear neurological reason for it. See, a migraine isn't just pain in your head. It's this complex neurological event, and during an attack, it can light up this massive nerve pathway called the trigeminal nerve. Think of it like a tree with branches that go all over your face, including in and around your nose and sinuses. So when that nerve gets activated, boom, you get all those symptoms. The pressure, the stuffy nose, even if your sinuses themselves are perfectly fine. And this table here does a fantastic job of breaking down the clues. On the one hand, you have neurological pain from a migraine. And yes, it can absolutely cause nasal congestion, but the real telltale signs are that throbbing pain, being super sensitive to light and sound, maybe even feeling nauseous. Now contrast that with a true sinus infection, what doctors call rhinosinusitis. That's when you're looking for things like thick, discolored nasal discharge, and often a fever or even losing your sense of smell. Knowing these differences, well, it's everything. So let's look at how researchers actually proved this neurological connection, how they went beyond just comparing symptoms. To really get to the bottom of this, scientists did what's called a systematic review. They basically scooped up all the data from 10 different studies and 7 clinical trials. They wanted to see, when you look at thousands and thousands of patients who all say, I have a sinus headache, what's really going on? And this chart, wow, it just lays it all out, doesn't it? The results were overwhelming. Primary headaches were the culprit almost every single time. Migraine was the big one by a long shot, followed by tension-type headaches. And actual sinus problems? They were way, way down in that tiny little slice. Okay, so there was another key piece of evidence, and it comes from this thing called an ex juvantibus diagnosis. I know, it's a mouthful, but the idea is super simple. If you give someone a treatment for a specific illness and they get better, that's a pretty darn good sign you found the right illness. So the big question was, what would happen if you gave these people migraine medicine? And this right here was the smoking gun. You had these patients who had suffered for years. They tried round after round of antibiotics, decongestants, you name it, and nothing worked. Then they were given triptans, a class of drugs made specifically to treat migraines. And what happened? Their sinus headache got way better, or just went away completely. That pretty much sealed the deal. The problem was in the nerves, not the nose. And this isn't just some interesting medical fact. The cost of getting this wrong is huge. Think about it. We see rampant overuse of antibiotics, which is a massive problem in itself. And get this, some studies showed that up to 41% of these people had gone through unnecessary sinus surgery, all because the real problem, the neurological one, was missed for years, sometimes even decades.
All right, so with all of that said, what does this actually mean for you? How can you break out of this cycle and finally get some relief?
It really comes down to this. The very first step, and honestly, it's the most powerful one, is just acknowledging that your sinus headache might not be a sinus headache at all. The moment you consider it could be a migraine, you've totally changed the game. You're no longer looking at your nose for answers. You're looking at your brain. And that opens up a whole new path to treatments that actually work. So here are 3 really simple, practical things you can start doing right now. First, like it says here, track your symptoms. Become your own health detective. Don't just write headache. Write down if the pain is throbbing, if light bothers you, if you feel sick to your stomach. Second, note your triggers. This is huge for migraines. Is it stress, lack of sleep, a change in the weather? Look for patterns. And finally, number 3, talk to your doctor. But don't just walk in and say, my sinuses are killing me. Go in armed with your symptom diary and ask them directly, hey, I've been tracking this. Could what I've been calling a sinus headache actually be a migraine? Because in the end, understanding what's really causing your pain is the key that unlocks everything else. It's what can stop the cycle of treatments that don't work, prevent procedures you don't need, and finally, put you on the path to feeling better. So the real question is, could the right diagnosis be what finally brings you relief?